Hey, welcome back to the channel. My name is Dr. Wayne Reagan. I'm a physical therapist. Just kind of creating some content here just to help with people rehabbing through injuries or pain. And today I have a series of videos planned with rehabbing elbow pain in mind. Let's get started. Elbow pain can often be a result of repetitive use activities or performing the same movement frequently. This type of injury is often referred to as an overuse injury that can oftentimes lead to tendonitis. And if we take a look at the elbow here, we kind of have two sides. And today we're going to be talking about the outside or the back side of the elbow, whereas most frequently elbow pain occurs. And this is kind of referred to as tennis elbow, or the medical term is lateral epicondylitis. This is often a result of continuous gripping with combined wrist and elbow movements or activities. So oftentimes people that use hand tools a lot, drills or jackhammers, things like that, will have an injury of these muscles, the tendons over here. Also, it's called tennis elbow, so people that use sports rackets, tennis rackets, pickleball, that sort of thing. Common injury in the elbow. Facilitate the healing of the tendon, you really should take a break from that activity for a couple of weeks, and then you can try some of these exercises that will facilitate the rehab of the tendon. So we're gonna, like I said, we're gonna do this in a series of 3 videos because there's kind of 3 phases of the exercises that I want you to follow. And so today's going to be the first phase, part 1, isometric exercises. And isometric is basically just holding resistance with the muscles without moving the joints, right? So it's just a static kind of hold against resistance. And so one way you can do that in this case is find a good surface to kind of rest your forearm on. Let your wrist kind of hang over the edge. And then we can either use a resistance band, which I have anchored to a dumbbell. You could also easily anchor it to the bottom of your foot. But in this case, we're just going to use the dumbbell, and then we're just going to kind of drape this light resistance band over the back of my hand. And that's intentional. I don't want gripping here. So because gripping can often be painful for this condition. So we're going to use the back of the hand here with the fingers straight. And we're just going to hold that resistance. So you're going to feel these muscles kind of tighten up, tense up. And just a 5-second hold in this position. Now, if this is okay, then you can try and sort of lift the back of your hand upward, bend the wrist upward. If it's not painful, then it's okay to hold this position for 5 seconds, all right? And so then after that 5 seconds, we're just gonna take that resistance off, maybe wiggle the fingers a little bit, let it recover for a second, and then we're just gonna put it right back on, and we're gonna go to that painful, or that non-painful spot, excuse me, of wrist extension. So bending the wrist upward as high as you can without pain, holding it 5 seconds. Now, if you don't have a resistance band, another good option is just a plastic grocery bag, shopping bag. And in here, I've got a couple of cans of beans, just a little bit of weight. Same sort of thing. Just put the handles over the back of your hand and lift your wrist upward. Again, kind of resting your forearm on the elevated surface here, a countertop, works fine. And we're just going to hold that up there for 5 seconds. Same idea as the resistance band. After that 5 seconds, we'll remove that resistance, wiggle the fingers, and then put it right back on. Another 5 seconds. Now this is a one or the other. You don't have to use the resistance band and the grocery bag, but 10 repetitions of either one, holding for 5 seconds, once a day for 3 days, okay? And then after that 3 days, you can increase the weight or check out the next video hopefully I'll be able to put a link up here somewhere, or maybe down in the comments, for the phase 2, part 2, where we'll incorporate eccentric exercises and gripping. Okay, so we'll see you in the next video.